Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on parturition. Now, before I start this presentation lecture, I would like to give you some highlights of this presentation lecture, how we are going to proceed in this presentation lecture. So, first of all, I will discuss the definition of the parturition with you. What is parturition and which are the changes that are occurring during the childbirth. Then we will study the role of the hormones in the process of childbirth, which are the hormones that are involved. Then I have included some of the concept maps during this presentation lecture, and then we will discuss the stages of labor, and in this lecture you will get the theory points and some good figures I have included. So now we are starting this lecture. As you can see, this is one pregnant mother, and in the womb, as you can see, now this baby's body, all the organ and the body systems are developed, and the mother is about to give the birth to this child. So the definition of parturition. Now, how to read out the spelling? That is the Parturition. The most of the time we are speaking as the parturition, but actually it is parturition. So parturition means the process of the childbirth, and it occurs, this parturition, at the end of the pregnancy. And during this process, what is happening? So as you can see, this is the fetus, and this fetus is expelled out from the uterus through the vagina. So basically, the childbirth literally meaning the expelling out of the fetus from uterus to vagina. That is the meaning of the childbirth. Now, the duration of the pregnancy, as we all know that the pregnancy duration is 9 month, nearly 9 month. Why I'm telling you nearly? Because there are a fluctuation in this time period. Sometime it will take 1 or 2 week time, more time, or sometime it will take 1 or 2 week lesser time. So that is the duration of the pregnancy. Now, the events of the pregnancy, which are the events that are taking place. So here, as you can see, this is the pregnant mother, and the baby's body is developed. So the point number one, the baby moves deeper into the mother's birth canal. So the mother's birth canal is this. This is the cervix, and this one is the vagina. So cervix and vagina, we can say, is the mother's birth canal. So the baby is moving to mother's birth canal. So now you have to see that as this baby is positioned towards the cervix, now what is happening, this baby's head is touching the wall of cervix and the body is touching the uterus. So now, since this baby's body has developed, so it is applying the pressure on the wall of cervix. So in the cervix there are pressure receptors. So these pressure receptors are excited, and the cells of the pressure receptor, they are generating the nerve impulse. So from cervix and the uterine wall, as you can see with this blue line, the nerve impulse is reaching to the hypothalamus. So now, as the nerve impulse reaches to hypothalamus, this hypothalamus, the fetal hypothalamus, is secreting the releasing hormone that is known as the corticotropin-releasing hormone. So here, as you can see, due to the stress this fetal's hypothalamus is secreting releasing hormone, and this releasing hormone is acting on the pituitary gland. So now this CRH is acting upon the pituitary gland. So the pituitary gland produces or secretes ACTH, that is the adrenocorticotropic hormone. So now when the parturition time begins, that means the childbirth begins, that time the pituitary secretes large amount of ACTH. So here in the figure you can see this pituitary gland of fetal is secreting large amount of ACTH. Now what this ACTH is doing? So this ACTH is affecting the fetal adrenal gland. So this fetal adrenal gland secretes the hormone adrenal corticosteroid hormones. Now where this adrenal corticosteroid is traveling? So this adrenal corticosteroid enters in the umbilical cord, and via the umbilical cord then it will affect the placenta. So adrenal corticosteroid is affecting the placenta. So now due to the effect of the adrenal corticosteroid hormone, the placenta produces large amount of estrogen and prostaglandin. As you can see, this placenta producing large amount of estrogen and prostaglandin, but at the same time it is leveling off the progesterone synthesis. That means the production or the synthesis of the progesterone is decreasing now. So this thing we have to keep in mind. Now another thing, that is the stretching response. So here as you can see, this body of fetus has developed now. So this is the fetus, and this 9-month-old fetus, that is the baby boy or the girl. So the body is touching the mother's uterus. So the mother's uterus, the wall of uterus, it is stretched. So now due to this stretching, this nerve impulse travels to hypothalamus, and then between the hypothalamus then the releasing hormone, and here as you can see this is the pituitary gland. Okay, so in response to this stretch of the uterus, the posterior pituitary is now secreting the hormone oxytocin. And what this oxytocin is doing? So oxytocin is causing the uterine smooth muscle to contract. Now we have studied the structure of uterus. So in the uterine wall we know that the outer layer is the uh, perimetrium, then middle one is the myometrium, and last one around the uterine cavity is the endometrium. And we know that this myometrium is made up of smooth muscle. Okay, so what this oxytocin is doing? So oxytocin is basically affecting the myometrium of the uterus, and due to the effect of oxytocin, this myometrium, the muscles of the myometrium, they are contracting. So the entire concept map I am showing you. So the all the discussion that I have explained to you, that you can go through this with this beautiful chart. Okay, you can see over here this oxytocin and where it is affecting. Now we are moving forward. Now, so what is happening? The placenta is secreting large amount of estrogen, and now what this estrogen is doing? So here now we are discussing this Braxton-Hicks contraction. Now, what is this? What are this Braxton-Hicks contraction? Now, this, as I told you earlier, that the placenta is producing large amount of estrogen, and this high level of estrogen is stimulating the uterus to form the oxytocin receptors. So one thing that the high level of estrogen is affecting, it is stimulating the uterus to produce more oxytocin receptor, and this rising estrogen level also stimulate the formation of the additional oxytocin receptor on the myometrium. So we can say some more receptors for the oxytocin, they are generated on the surface of the on the myometrium. And this estrogen, high estrogen level, overrides the quieting influence of progesterone. Now, what is the meaning of this? Now, we have to understand this. For example, this is the uterus, okay? And here in between perimetrium and endometrium, this one right now that with the red color that I am drawing, this is the myometrium, okay? And progesterone P, progesterone is affecting on myometrium during the entire 9-month pregnancy. So what this progesterone is doing? So this progesterone is keeping the myometrium quiet. So myometrium is not contracting because the development of the baby is going on. The body organ and the body systems are developing. So if the myometrium contracts, so there are the chances of the abortion of the baby. So to stop this, the progesterone is keeping the myometrium quiet. But now the baby's body is grown, all the organ and the systems are developed, and the baby is about to release from the mother's vagina. So baby is about to come into our world, okay? Now, since this high level of estrogen is keeping the is overriding this irritable contraction, okay? Now what I am trying to explain you that the this progesterone was keeping the myometrium quiet, but now the child is about to deliver. So now this estrogen is becoming irritable because the effect of the estrogen. Once again, what this estrogen is doing? So estrogen is basically removing the quieting influence of progesterone, and second thing, it is irritating the myometrium. That means it is contracting the myometrium, and this contraction of myometrium due to the effect of estrogen, these contractions are irregular contraction, and these contractions are known as the false labor, okay? And this contraction are known as the Braxton-Hicks contraction. Now, due to this contraction, baby is not going to born, okay? So this contraction do not result into 3 stages of labor, but the pregnant woman sometime experience this strong Braxton-Hicks contraction, and she thinks that the baby's birth time has came. So she thinks that within a few minutes she is going to deliver the baby, but that is not the case. The actual labor pain happens after few hours when the intensity of the uterine contraction increases. So that time baby's birth is possible. So this is the meaning of this, that the Braxton-Hicks contraction. You can go through this, what is the meaning of this, and if you are interested you can also go through this point also. Now we are moving forward. Now one more thing, here you can see this is the this part is the this is the cervix. Now we have already studied the structure of the cervix, and in the cervix there are cervical gland, and this cervical gland they are secreting the mucus. So this here you can see this is the mucus. So here this mucus is making the mucus plug. So what this mucus plug is doing, so mucus plug is closing the passage. Okay, now passage for what? Now mother is pregnant. Okay, it is possible that the couple, that the mother and father, they perform the sexual intercourse during the pregnancy. So the in the father's semen there are the sperm. So now since this mucus plug is there, these sperms cannot penetrate this mucus plug. And here why they cannot penetrate, because the development of baby's body organs are going on. So this sperm cannot irritate the development of the baby. Okay, so this entry of the sperms is prevented by the mucus plug. And second thing, the microorganism, for example the bacteria, they cannot pass through this mucus plug. So this mucus plug is basically it is protecting the developing baby. But now the pregnancy period is over, 9 month duration is over, so this mucus plug is discharged. Okay, so as you can see here, this mucus plug is discharged now. So when this mucus is discharged, so it is somewhat clear, and it is having a blood sometime. Okay, so when this mucus is discharged, that time the woman, the pregnant woman should realize that the baby's birth time has came, and she is being advised to be admitted in the hospital, because it is possible that the after few hours or few 1 or 2 weeks she is giving about to give the birth to the child. So this mucus discharge is the sign that the in few hours or in 1 or 2 weeks he is going to deliver the baby. So that is the meaning of this point. Okay, now sometimes what happens, that the baby is not baby's body is not moving that much, and the mother is not capable for this labor, means the uterus is not contracting as much the requirement. So that time when the uterus is not contracting properly, or sometimes the mother choose the time to give birth to the baby. For example, the mother, let's say the mother is the strong believer of the astrology, so she want to give the birth at a particular day or particular time. So now the gynecological doctor, what he will do, that he will apply prostaglandin gel to the cervix, so that the cervix is dilated. Okay, because mother was not able to dilate the cervix naturally. So that time the gynec doctor will apply this prostaglandin gel, so the cervix dilates. And another thing the doctor will do, that uh, he will inject the synthetic oxytocin solution, that is known as the pitocin. So pitocin is given to dilate the cervix. Okay. Now the stages of labor. So the process of labor is divided into three stages. One is dilation stage, second is exclusion stage, and third is the placental stage. So one by one we are discussing all the stages. Now during dilation stage, what is happening? The cervix is fully dilated and the diameter of the cervix is close to 4 inch, that is 10 centimeter. In the figure I am showing you, for example, let me find out the figure over here. Here this is, as you can see, here it is written. Okay, and here you can see the cervix is dilated and this gap is 4 inch. Okay, so we can say cervix is dilated now. Now with this you will get the idea. Okay, with this figure you can see this is the beginning of the dilation. Okay, and here as you can see the cervix is fully dilated. Okay, so this is the first point. This was the first point, that the cervix is fully dilated. Now the labor pain, that is the contraction. Now where this contraction originating? Okay, so this contraction of the uterus, they originate on the upper part and then this contraction they travel or they move toward the vagina. Okay, so in the figure I will show you this point. As you can see here with the blue arrows, here the contraction has started and this contraction, okay, they are moving towards the vagina. As you can see over here, this contraction. Okay, so this is the direction of the uterine contraction. So on the upper part the contractions start and they move towards the vagina. Now as the labor progresses, the contraction of the uterus becomes stronger and stronger, and then later on the lower part of the uterus also involved in this contraction process. So upper part is contracting, lower part is contracting. So basically this contraction are pushing the baby's body towards the cervix. Okay, now the duration of the dilation stage. So as you can see over here, I have mentioned that the dilation is the longest stage of the labor, and the length or the time period of this dilation stage is generally 8 to 24 hours in the woman which is first time pregnant. Okay, so for first baby the duration of the dilation stage is 8 to 24 hours, but if mother is about to give birth to their second child, so the duration for the dilation stage will be shorter and it is having the length of 4 to 12 hours. So this is about the dilation stage we are discussing. Now this point, head first presentation. Okay, so baby's head is pointed towards the cervix. Okay, that is the meaning of this thing, as you can see. Okay, the baby's head, so head first, that means the head is towards the cervix. So so this is the, for example, this is the cervix, okay, and here if I draw the baby's head, so when the baby's head, because the uterus is contracting baby's body, okay, it is pushing, so what happens due to the pressure of this fetus head, this wall of the cervix becomes thin, okay, and at the same time cervix is also dilating. Now another point, this point, water breaking or the rupture of the membrane, okay. So here, as you can see in the figure, I will show you this. This is the, this one is the amniotic sac, and we know in the amniotic sac there is the amniotic fluid, okay. Over here you can see, over here this is the amniotic sac, and now in this figure you can see the water break. So what is happening, the amniotic sac is rupturing, so whatever the fluid which is present in the amniotic sac, that fluid is discharged, is that fluid is coming out from the vagina. So because this fluid, due to this fluid, the passage, that is the vagina and the cervix, they becomes fluidy, they becomes watery. So it will be easy journey for this fetus head and the entire body to travel into mother's birth canal, that is the cervix and the vagina. So that is the way this rupturing of the membranes, that is the breaking or rupturing of the amniotic sac, is helping, okay. Now sometimes this amniotic sac do not ruptures naturally, so at that time with the some surgical instrument, the gynec doctor manually ruptures the amniotic sac, okay. Now now towards the end of the dilation stage, the fetus enters, the head of the fetus enters into the true pelvis, okay, and now the head can head rotates, the fetus head is rotating now, okay, and so that it can easily pass to the pelvic region. So I will show you this, the head rotation in the figure. So with this you can see how this, it is pointed toward this and how it has rotated over here, it is rotated, okay. So the delivery becomes very easy, okay. So this point we have discussed. Now the exclusion stage, okay. Now what is exclusion stage? So exclusion stage is the time from full dilation to the delivery of the newborn. Okay, once again, exclusion stage. What is exclusion stage? Time between the full dilation and the delivery of the newborn. Now, what is happening over here in this exclusion stage? That the cervix, once the cervix is fully dilated, okay, cervix is wide, okay, and the head has, the fetus head has entered into the cervix. Now what happens, the uterus, wall of the uterus, it is contracting very strongly, okay, and this contraction of the uterus, this contraction are often assisted by mother's abdominal muscles. So mother is knowing that the fetus head is in the cervix, so mother voluntarily pushes her abdominal muscles. Okay, so mother is also increasing the pushing pressure on baby's body. So this thing is known as the pushing or the bearing down. So the head and the baby's body is entering into the this vaginal passage. Okay, so now this stage, that is the exclusion stage, it is taking the time for few hours. Okay, and typically the range is the 30 minutes to 1 hour. So exclusion stage will take a time of 30 minutes to 1 hour. Now the crowning, the process of crowning. What is crowning? Okay, so I will show you the in the figure. Okay, as you can see, this is the crowning. Here the fetus head, this one, is first time coming out from the vaginal orifice, that is the vaginal opening, and some incisions are made by the doctor. So what happens, as this crowning has occurred, the gynec doctor will insert some of the surgical instruments uh, around this fetus head, and basically the doctor is trying to widen this opening so that the head can easily come out. So that point I have written over here. So that incision performed by the gynec doctor is known as the episiotomy, to widen the opening of the vaginal orifice. Okay, so first the head is coming out, and then the entire body of the baby comes out. So once the baby comes out with the umbilical cord, so the umbilical cord, then it is clamped and it is cut. Okay, so I will show you the exclusion stage. Here you can see this is the crowning, and this you can see this is the exclusion stage. Entire head has come out from the vaginal passage. Okay, vaginal orifice, vaginal opening. Now we have discussed the second point. This point we have discussed, this point we have discussed. Now we are discussing this. Okay, now sometimes what happens, the pregnant mother is underage, or the mother's health is not good. Okay, or the baby's health is not good, or the baby's position is not proper. That means the head is not pointed towards the cervix. Okay, or we can say the baby is in the inverted position. Okay, sometimes the umbilical cord is wrapped around baby's body, so that time it is not possible to perform the normal delivery of the child. So at that at that situation, the doctors suggest the pregnant woman that the cesarean should be performed. So what is cesarean? So cesarean is known as C-section or the cesarean section. So in which with the surgical instrument, the cut cut is made on the abdominal muscle and the uterine wall, and with all care taken, gently the team of the doctor, nurse, and the compounders, they gently remove the baby's body from mother's womb or the uterine cavity, and they also remove the fetus placenta. Okay, so this is how the cesarean is performed. Then the last stage of the labor, that is the placental stage. Okay, now after birth, what is after birth? This term I am explaining. Okay, so here you can see, good in the, for example, in this figure, as you can see, you just observe, this is the baby's body. Okay, this is the pink color umbilical cord, and here the placenta is shown. Over here also baby's body, umbilical cord, and this one is the placenta. Okay, exclusion stage. Okay, and this is the placental stage. Okay, so what I'm trying to explain, that when baby when mother gave the birth to the baby, that the baby's body came out, so this umbilical cord has come out, okay, along with the baby's body, and you can see this entire structure, that is the maternal placenta and the fetal placenta. Okay, they also come out, and the extra embryonic membranes. So once again, umbilical cord, fetal placenta, maternal placenta, and extra embryonic membrane. They come out along with the baby. So that is called after birth. So here you can see this is the placenta or the after birth, and between this there is the umbilical cord, and then there is the baby's body. Okay, so this is the meaning of the term after birth. Okay, now during the placental stage, the placenta is coming out along with the umbilical cord, and the uterus is continuously contracting, because this contraction are helping the blood vessel to compress. So once the blood vessels are compressed, so it is stopping, it is limiting the bleeding from the uterus wall. Okay, so this contraction of the uterus are helpful to limit the loss of the blood. That's why they are contracting. And this placental stage, this stage typically takes the time of the 30 minutes. Okay, and many a times the healthcare provider, that means the nurses or the compounders, what they are doing, they are simply tug on the umbilical cord. So they are gently, they are stretching the umbilical cord so that the placenta is detached from the mother's uterus. Okay, so that way they are helping the delivery of the new baby. Okay, which is about to come in our world. So that is the meaning of this thing. Now, the complete removal of placenta is very important. Otherwise, if some part of placenta has remained attached with the uterus, so what happens? The uterus will continuously bleeding. So it is very important that the persons which are involved in the part parturition process, they, with the all care taken, they remove the umbilical cord and the placenta, so that mother uterus will not bleed. So that's why it is very important to gently remove and detach this placenta. okay, along with the umbilical cord and the baby's body. So these are the changes of placental stage. Okay, now few more things I would like to show you.